Hey guys, Dr. Luster here, and this is video number 2 of the, well, I guess technically 3, but number 2 of the actual issues that we were talking about related to blood sugar. So the first video we did, we talked about the normal. So I definitely want you to go refer to that in comparison to what we're going to talk about now. So normally, blood sugar should stay fairly neutral and it goes up and down as you eat, right? And it doesn't spike too far out of range or anything like that. But I want to talk today specifically about how it affects your blood pressure. So this is actually going to be multiples because it's going to be related to cholesterol and all of these things. So I want this to hopefully be in concise little things so you can understand them in pieces rather than in one big long video with me rambling. Okay, so blood sugar, it causes blood pressure. It is one of the dominant things that causes blood pressure. And the reason for this is because there is not, as you eat things, like we talked about in the first one, as you eat things, they're turned into glucose in your digestive system, and the glucose is the number one source that your body needs, so it lets it in indiscriminately. So from your gut, pretty much all glucose is absorbed through your gut and directly into your bloodstream. Once it's in your bloodstream, then it's going to be picked up by cells and utilized. So when things start going wrong is when there is too much sugar coming from the gut, because the gut has no filter. The gut doesn't have a valve or a wall to say time to close, there's too much coming through. It just lets it all through. So what happens then is that all of that's coming through is now in the bloodstream, and it's becoming kind of crowded in here, you know? So as more and more glucose comes through that bloodstream into the bloodstream, you're going to start seeing, excuse my cat cameo here, you're going to start seeing that it gets a little bit crowded in the bloodstream. And as that does, the more crowded it gets, the more pressure is going to be created on the outside of that vessel. So think of it like a hose, right? And if I'm starting to put sand into that hose, the sand is the glucose, then as the more sand I put in, the more, but I'm keeping the same amount of water in there, the more there has to be something that gives, right? So the hose is going to try and expand to create as much room for it, but it can only expand so far. So you start seeing an increase in blood pressure, which then stresses that vessel. And you start worrying about something like it popping, you know, somewhere it's gonna release the pressure off, right? So the problem is that there's too much blood sugar in the bloodstream, and it doesn't have an outlet for it. So as we move on to the next video, we're going to take this to the cholesterol standpoint. There are a few places, though, that I want to mention where blood sugar tends to be released a little bit, and those places, blood sugar and blood pressure actually at the same time. So those places tend to be at the ends of vessels. So as your bloodstream goes through things, or goes through from your heart, basically, you have your arteries, and then your arterioles, and then your arterioles. And then at the bottom of that, they change from arterioles to capillaries, and then the capillaries to venules, and then to veins as they come back to your heart. So during that arteriole, capillary, venule area, they are changing to become more porous. So this is like where pressure is released out of the system, because they are more porous to let out some of the water, to let out some of the bigger things other than glucose. So some of that can help be relieved in the external areas, or around the distal areas, the further away areas. That does tend to result in things like swelling, which we will talk about as well in another video. But I wanted to clarify that with blood sugar and blood pressure, there are built-in ways to help release blood pressure, but they are not foolproof. And if you are, another built-in way, we'll talk about in a second, but if you are pushing that too much, then you're going to overwhelm the system, and it's not going to matter because it's going to be overly saturated. Another fantastic way that we also relieve blood pressure is through your kidneys. And so your kidneys are designed to actually manage this blood pressure system. So they filter the blood and they take out any toxins and whatnot with a little bit of water, but most of it they send back, and they remove it from your body through urine. That is the entire point of your kidneys, is to help manage that, the blood pressure and the stuff that's in your blood, to serve as the opposite of the pump, because with the pump of your heart you need a filter, right, to filter out any things that are coming in, because you have something coming in but you got to have them coming out, right? So the problem that we start seeing with some of this increased blood pressure is that it starts creating too much pressure on that filter. So as all of these little grains are starting to push on this filter, and there's too much of it, and now there's too much water pressure, and we can't super get rid of it because now the capillaries are overwhelmed, then we are forcing the filter to start puncturing holes in it that are slightly too big, because your body, like I said, it needs glucose. It is not designed to get rid of glucose. And so once all of that increased pressure is happening, it's going to start punching holes in your kidneys, in your kidney filter, basically. And those holes are going to start letting blood sugar out to relieve some of the pressure. It's kind of, they're really trying to let out the water, but it ends up being that the blood sugar comes out as well. So this is important because you're ruining the integrity of the kidney, because now things that are coming out shouldn't be coming out. So you see this a lot with like diabetics, for example, where you actually see sugar in their urine. And this is important because it is the start of kidney failure, because the more we've lost integrity, and we're just heading down that road to lose more and more integrity of that kidney filter, if that makes sense. So this starts with blood pressure. We're going to talk about cholesterol here. We're going to talk about some more kidney stuff, and we're going to talk about some of the swelling and stuff you might see with increased blood pressure. But specifically related to blood pressure, it causes high blood pressure because you're eating too much sugar, or you have too much sugar coming into your system. So I hope that clarifies, and I will see you in the next video. Thanks, guys.